Good morning and welcome to today's edition of Living Well. I am so grateful that you tuned in to watch us. On today's show, as always, it will be fun and educative. We'll bring you the foodie segment, one of my favorites, and then we'll do the aerobics. We'll bring you the what do you know? And of course, we will go on the street to find out what people know about today's topic. We are live on Facebook at Metro TV Ghana. And so if you want to step out, you can always carry us along. My name is Ethel Poplampo. We'll be right back. Please, come and mic my guest. I totally agree with our inspirational quote for today. A healthy outside begins from the inside. Maybe that's why the foodie segment is my favorite, because whatever you put into your body reflects on the outside. On today's show, we are going to talk about diabetes and how it has become a global menace, and what you need to know about diabetes, what you have to do to live well. I will introduce my guest, but before you see them, let's take their profiles.
Dr. Konedu is a specialist family physician with Manhyam Polyclinic, Tema. She has a background in both primary care and public health. Dr. Konedu is a medical practitioner with 10 years experience in primary care. She seeks to promote patient-centered and holistic care with regards to health-related issues. Dr. Samuniama, Vice President of the Public Health Alliance International Ghana, public health physician with diverse focus areas, medical practitioner with experience in both public and private practice. He aims to help bring more visibility to pertinent health issues within Ghana and Sub-Saharan Africa.
So clearly from the profiles, you might have deciphered why I'm smiling and over smiling, because the feminist in me is happy that for the first time since the show started, there is a female panelist on the show. And so I am happy. Thank you very much, Dr. Dakwa, for joining us. I'm very, very grateful.
I'm happy to be here. Thank you
for having me. It's so nice to have you here. Now, Dr. Samuel Nyama.
Yes.
Last man standing.
Yes.
Do I really have to welcome you every time you come? Because this place is like your house.
You know, yeah. And I must say that Dr. Konedu is going to be the first of many women who are going to grace the show. Yeah. There are a lot of them in the practice. Actually, I think, currently there are probably a lot more women in the practice than men.
Yeah, interestingly, the medical profession is seen a very balanced.
Yes, yes. So you're going to see a lot of them.
Going forward, we'll see a lot of female doctors. But even though this place is your home, thank you for always joining us.
You're welcome.
I'm very glad that you are on the show today too. Today we are going to talk about diabetes. It is scary, and a lot of people have diabetes. Some don't even know that they have diabetes. So very soon we'll get into the discussion. But before we get into the discussion, let's take public views on what they know about diabetes.
Diabetes, as everybody knows, is a chronic disease. And when you say a chronic disease, that's something to do with how sugar is being regulated in the body. And as you rightly said, in the body, certain mechanisms come into play so that sugar can be regulated. And we have the pancreas. The pancreas contains two cells. We have the alpha and the beta cells, which produces the insulin and the glucagon, which controls sugar. So with the diabetes, it's not as if like we've eaten plenty. People have the notion that we have eaten plenty sugars and like the sugar is plenty in your blood. But what happens is that it could be two. One, it could be that your pancreas is no more functioning well. Maybe there's through accident or something, or through certain medication that you see, your pancreas is destroyed and it's no more producing the insulin. Or it could be that the insulin is being produced all right, but the cells are not using it to their benefit. When it happens like that, the sugar level or the glucose level in the body, in the blood, in the body becomes more in the blood, or glucose level becomes more in the blood. So when you test with the glucometer, you find out that your sugars are high. That's what you mean by diabetes.
When someone eats a food and the food is not well digested, because the insulin is not able to function well, it could lead to diabetes.
There's too much of sugar for the body. The body needs some small amount of sugar. So if you are taking much sugar to affect the body, and with that, I think it's when you have a soil, it take more time before it heals. That's what I know about diabetes.
Ebia obi wo didi ya na wo de ada. Se wo didi ne se wo de da ne se wa ntwen amadwane na anhransa. Eno nso de asikyire yale no eba. Ane se obi won susu no onya sa yare na. Wo hwe wadidi mu yi a hwe ntime nyewo.
Na me fa diabetes ho ne se omo se yare bi a ife na asikyire yare. Se eya wo na se wan control na se wan hwe ohu yi a ebetumi ama ekura beto wo na ho. Ana se kuro no so anye yi ebetumi nku etwa.
And some of the symptoms is that when someone is affected by diabetes, you could realize that some grow lean, some they develop sores in their legs or their arms or any part of their body.
Say sugar was so Johnson na the good for bon once na aba ho. Na say oh e say okọ doctor so ko check e. Okọ e be bo won sa ha. Ni wo hu say e bia.
Night sweating is one of them. Secondly, to some people today urinate more at night. Some weight loss is one of them. Then irritability, and when it progresses to, you can go to the hypoglycemias and those stuff.
Right, those were interesting views from the public, but the advantage you have over everybody else today is that you have health experts in-house to help us tell us what is true, what is the myth, what is the housewife theory. So join us, don't go anywhere. As I mentioned earlier, if you want to step out, we are live on Facebook at Metro TV Ghana, so you can carry us along. Dr. Darko, let me start with you. We heard a lot from the Vox Pop. We heard a lot of medical words from one person. We heard people saying indigestion can cause diabetes. We also heard someone saying if you urinate, there are certain things you have to look out for. What is diabetes? Because there was a lot going on in the video. What exactly is it?
Okay, so to understand what diabetes is, you must first understand that your body is like a car. And like every car, you need petrol. So when you eat, the food is changed into something that your body can use. That is glucose, what we sometimes call sugar. It's not the table sugar necessarily that you eat. So a common misconception is that if I stop eating sugar, I won't get diabetes. It's not just about sugar. Yes. So the foods that we eat that have carbohydrates, so rice, yam, akple, bangkong,
basically everything we eat.
The foods that Ghanaians we like to eat the most are starch heavy. And these carbohydrates get into our bodies and our body changes it to glucose. Now, this glucose, your body needs it. It's our petrol, okay? But it needs to get into the cell. It needs to get inside every cell. We are made up of different parts. Every part needs this petrol to work. Now, before the petrol can get into most of our cells, it needs a key. And that key is what we call insulin. Okay. Now, diabetes is a problem with our insulin. Either you are not making enough insulin, or the way your body is able to use the insulin is no longer working well. So it's like an old key, it's a bit faulty, or you can't find your keys. You don't have enough keys. Okay, so that's mainly the problem of diabetes. So when that happens, then your blood sugar, the sugar in your blood, you are eating all right. The sugar is getting into your blood, but the places that need it, they don't get the sugar, and it starts accumulating in your blood. And then you say you have high blood sugar and you have diabetes.
Okay. Yes. So when they say you have high blood sugar, it's not that you have over eating sugar, but just that the sugar your body has is not going into the places it's supposed to go, right?
Yes, and so the sugar that is now in your blood, because these places, they are communicating. Your body, each part communicates with the other, and they need the petrol to work. So they are like, hey, I need that petrol, I need the energy, I need the glucose. So where is it? So your body keeps pushing more and more into your blood because it assumes that, oh, the insulin is working. Okay, so let's put more, if the cells need more glucose, let's put more glucose in the blood, because that's the way that they will get this glucose that they need.
Okay. Okay. Dr. Newman, Dr. Dakom broke things down very well, but can you shed more light about the insulin and how it works?
Okay. So as Dr. Dako said, the body thrives on that fuel called glucose. And then when this glucose is in your blood, it has to get to the cells. When it's in the blood, it's really of not much use to the body. It has to get in the cells for it to really start working. So what happens is that, there is this organ in our body, call it the pancreas. It's around our stomach, in our belly. And then what this pancreas does is that it contains certain cells that produce a chemical called insulin. And this insulin really runs through our blood. And then what this insulin does is to help this glucose that is just in our blood to get into our cells. And for it to happen, it's like a lock and key. These cells have certain areas on them where this insulin communicates with the cells. And when the insulin communicates with the cells, then the glucose will be able to what? Drive into the cells to be used by the body. So really, in diabetes, what happens is that it's either the pancreas is not producing enough of the insulin, or it's not even producing this insulin at all. That's one. Or the site that's supposed to communicate with the insulin for glucose to enter into the cells is malfunctioning. There is a problem there. And so there isn't that communication for the glucose to be transported into the cell. So we call it insulin resistance. It's being resistant to that insulin that's supposed to communicate with that portion of the cell to get the glucose into the cell. So really in diabetes, that's what happens. It's either there isn't enough of the insulin, or there isn't insulin at all that is being produced, or there is resistance where that, there is an issue with that communication, and therefore the insulin is not really getting, communicating really with that part of the cell to get the glucose in. So that is really what brings about diabetes.
Right. So if I get what you are saying, insulin is a byproduct of the pancreas. So it's not like the insulin is an organ in the body. No, it's not an organ in the body. And it's not even necessarily a byproduct. It is actually a chemical that is produced by certain cells in the pancreas. Okay. Yes. We call it, it's a hormone. It's a hormone. Yes, there are other hormones that are produced in the body, and they all help to regulate the body's function. Insulin is one of them.
and insulin is produced by the pancreas, those particular cells in the pancreas. I don't want to go into technicalities.
So is the pancreas' main job, is it to produce insulin?
It's one of them.
Okay, so it has other functions.
Yes, it has other jobs, but producing insulin is one of the major responsibilities of the pancreas.
Right, we will get into the functions of the pancreas maybe later in other episodes.
Right.
But then I've also noticed that a lot of advocacy, a lot of volunteerism, and a lot of finances, a lot of work is being done to bring attention to diabetes.
Yeah.
I know of Nick Jonas, who is very vocal when it comes to diabetes.
Yes.
And we always hear of the word menace. Whenever there's diabetes, there's menace.
Yes.
How worried should we be?
Yes, we call it a menace because, you know, diabetes is so interconnected with other medical problems. You know, once you get diabetes, you are at a very high risk of contracting other chronic diseases and vice versa. And that's why we call it a menace. And would you believe that currently in our world, there are over 530 million people who are diabetic, as we're talking about.
That's those who have been diagnosed.
Yes.
There are still people out there
Exactly.
who haven't been.
And if you should count your finger to 5 seconds, one person dies of a complication of diabetes. One person dies of a complication of diabetes. So you're talking about 12 people dying in a minute, and then what? 12 times 60, that's over 700 people dying by the time we finish with the show. It's just to give you an idea of how much of a menace diabetes is.
Right. Still staying on the topic of Nick Jonas, he keeps mentioning types.
Yes.
I'm type A, type B. How many types do we have?
Okay, so when it comes to diabetes and types, there are various types. Basically, there are really 2 types, but there are other types as well that we can go into it. So talking about the types, I initially spoke about, you know, diabetes being brought about as a result of either inadequate or lack of insulin, or insulin resistance. Yes. So when you talk about type 1 diabetes, you know, you're really talking about the situation where there's either inadequacy or lack of production that is usually caused by what we call an autoimmune disease. So you have an immune system that's supposed to protect you from infections and other dangers as far as your body is concerned. But what happens is that this immune system sometimes produces certain chemicals, you know, or certain cells that attacks, you know, other cells in your body, your own cells, like producing things to attack your own self. That is what we call autoimmune. And so in some instances, you know, the cells that produce insulin in the pancreas gets attacked by your own cells. And then they get destroyed, sometimes completely or partially. And then when that happens, the pancreas is not able to produce adequate insulin. So that's what we call the type 1. That's usually the autoimmune. And then when we come to the type 2, I told you that insulin can be caused by a result of resistance. So when it comes to the type 2, in this case, as I said, insulin is being produced, but really the cells are not communicating with the insulin to get the glucose in there. So that is really what brings about the type 2. And when we talk about the type 1, it's usually seen mostly in young people. It's usually seen mostly in young people with the type 1 diabetes. There are variants of that type that is seen in old people, but as I said, there are other types of diabetes. Dr. Akunodi will probably touch on those. Yes, so it's usually seen in young people, and that with type 1 diabetes, it's usually abrupt. The child will be there, will be fine. Sometimes they will probably not complain so much of any symptoms, and that within a very, very short period of time, the child will tell you, Mommy, I'm having this abdominal pain. I feel like I want to vomit. my heart is racing, I'm sweating, you know, and these symptoms, sometimes we call it DKA. We'll get into that probably during the second part of our diabetes discussion. And that is the time that you would actually get to realize that this child has diabetes. Sometimes when they come to the hospital, that is the very first time you get to realize this child. So diabetes type 1 usually occurs in the very young, and they are mostly abrupt. But the good thing is that because they are abrupt, they usually happen very fast. They don't get to destroy or affect the organs in our system as much as the type 2, which tends to be a lot more gradual and therefore causes a lot more damage before you realize it. But the good thing about type 2 is that you usually also tend to see symptoms, you know, a lot quicker just because it's gradual. You'll be experiencing symptoms, maybe not as florid as the type 1, but then you're going to be experiencing some symptoms before you even get to that stage where a lot of your organs are going to be so damaged, you know, beyond repair. Okay. So these are some of the distinctions.
Okay. Yeah. Dr. Dako, let me come back to you. Dr. Nyama made it known that the type 1 or the type A is not as severe or deadly as the type B. Is that what he is trying to say?
No.
Okay.
No, they are both a problem.
Okay.
Because they present with the same issue. You don't have the insulin you need. Either you have it and it's not useful. If you have a key and it can't open your door, then what's the use of the key? Okay. Or you don't have the key at all. That's the type 1. Okay, so they are both deadly. They are both serious. They are both things that we have to start looking out for within our society, because you said something that a lot of people don't even know. Yes, he said 530 million people are living with diabetes, but it will surprise you that 50% of those who have diabetes in Ghana are not aware that they have diabetes. So you are walking around with a time bomb and you don't even know. I like to liken diabetes to a termite infestation. You know, when termites get into wood, you don't know. You'll be using the chair, sitting in it, using it. The day you sit in it and it breaks down, you say, but I sat in this chair just yesterday and it was fine. You might see a few shavings on the floor, but if you're not thinking about it, you wouldn't know. And that's what diabetes is like. In fact, most of our chronic diseases, diabetes, hypertension, that's what they are like. You don't know it. Maybe you have a few symptoms here and there. You may attribute it to something else. Oh, I'm tired. There was a man on your show who said, you know, indigestion. If you don't eat and the food doesn't digest. So you find ways, you know, to justify the way you are feeling, but it's diabetes. And like Dr. Nyama said, it's destroying things, especially the type 2. Because it's so insidious, you don't see it outright. It's destroying things. By the time you see it, a woman said it can attract flies. I think she was talking about ants. Okay. When you urinate and you leave it, if ants come around it, it means that most likely you have diabetes. But if you are waiting for ants to come, by the time ants are showing up around your urine, you have a big problem, because it means it's advanced to a certain point that complications have already most likely started setting in.
So we've established that there are 2 types of diabetes.
Okay, I'm sorry.
Okay.
So there are other types of diabetes. Sure. Type 1, type 2, but there's also a diabetes that you can get when you're pregnant as well. Since today we have women on the show. Yeah.
I think I've heard it before, gestational diabetes.
Yes, gestational diabetes. So gestational diabetes is a type of diabetes that shows up when you get pregnant. But the thing about gestational diabetes is usually after you deliver, the problem resolves. Your sugars go back. However, having just
they said however
exactly having gestational diabetes increases your risk of developing diabetes in the future, like the type 2 diabetes. Yes, so it doesn't mean that, oh, I had it when I was pregnant, so I'm okay. If you have diabetes when you are pregnant, you have to really be careful about the modifiable risks that you can change, your lifestyle changes, so that you delay or even prevent the onset of diabetes.
We've heard about a lot of things today, but then most importantly, we've established that diabetes is an insulin problem. It's either you're not producing much or much is not going to your body. Is diabetes caused by the way you live? Because gestational diabetes, it's because you are pregnant. Is it a lifestyle disease?
So, yes, I like that. Diabetes is an insulin problem, but most of diabetes is a lifestyle problem. Type 1 is an autoimmune issue, so it's a little different. Your body is attacking itself. That one, you can't really do that much about it. But once you have diabetes, and the type 2 diabetes, lifestyle plays a major role in the prevention of that kind of diabetes. And when we say lifestyle, what do we mean? One of your people talked about eating late at night. It's our diet, the times we eat and what we eat. Lots of our foods are starch heavy. If you mention any Ghanaian food, if I ask you what you ate last night, if I ask all of us what we ate last night, starch heavy. Yeah. It's either some fufu or some rice, some bread, wache, jollof, gobe. You know, these foods.
The gobe. If I don't add gari, is it still starch heavy?
You have plantain, you have beans. Beans have some amount of carbohydrates, and then gari has carbohydrates as well. So that's also the thing. It's not only traditional starches that have carbohydrates. So your beans, you have some amount of carbohydrates in there. Milk, you have some amount of carbohydrates. Carrots, fruits, vegetables, you have fruits mostly. Even vegetables, you have a little carbohydrates in there. Okay, so in everything you are eating, there are starches, but the amounts are the most in our rice and bread. They are dangerous foods, we just don't know. Okay. And we like it so much. Yeah. It's something we eat, it's become a staple. We are always eating rice, we are always eating bread. And it's a lifestyle disease because your diet and our exercise. Previously, our people were walking to the farm, walking to school, walking everywhere. Now, most of us, we sit in the house, we sit in a car, we sit at work. We don't have time to do any exercise. We don't have anywhere to do any exercise. So diet, exercise, stress. I think stress and sleep. If I'm not wrong, somebody mentioned it, one of the people who spoke. Increased stress levels can also increase your risk. And another thing, obesity, our weight. A lot of us, if we do our calculations, we all fall under obese. There are different classes, either overweight or obese. And that's also something that can increase your risks. But it's not only lifestyle. There are certain things that also lead to diabetes. It's something of a hereditary condition. Okay. So if somebody in your family, we call it, if your first degree relation, so first degree meaning your mother, your father, your siblings, if somebody, or your children, if you are old enough, if somebody has diabetes, it increases your chance tenfold of developing diabetes. So if we all think about it, we may have one or two parents with diabetes, grandparents with diabetes. Once you see things like that, you should know that if you don't watch what you do with your lifestyle, most likely that will be you too in the next few years. From these days, 30-year-olds, 40-year-olds are all coming down with diabetes. So lifestyle, yes, is a component, but there's also that genetic component. There are also the fact that increase in age also increases your risk. You can't change your age. We are all growing older. So if you take a 30-year-old and you take a 50-year-old, you have the 50-year-old having a higher chance of developing or having diabetes than the 30-year-old. Doesn't mean the 30-year-old can't have it. It's just about probabilities and chances. So lifestyle, your family history, and your age. You can't change your age. And then obesity as well, like I talked about. These are the things that we really have to look out for when we are talking diabetes.
Right. Dr. Neoma, Dr. Darko has established that lifestyles, family history, can where you come from also predispose you to diabetes? Because it looks like a lot of Africans have diabetes, or I just watch a lot of movies.
No, you're actually right, and it's good you brought this up. You know, I mean, race actually has been shown to the black race has been shown to be a higher risk as far as diabetes is concerned, even other cardiovascular diseases. You know, people of the African origin, we've been shown that they are more prone to some of these chronic diseases. So you're not wrong at all. I mean, that's one. And then the other thing I would want to add, also has to do with certain medical conditions.
Yeah, I was just about to come to that because Dr. Darko, one of you said that when you have diabetes, it leads to other.
Yes.
But then when you have other condition, does it lead to diabetes?
Yes. So when you have other conditions, it can lead to diabetes as well. And the first thing is that I'll probably zoom in a little on the pancreas itself. Sometimes it's not that the cells that are supposed to receive that communication from the insulin is not working, but sometimes it's because something has happened to the pancreas. It could be an infection. There have been times where chronic infection of the pancreas has actually led to diabetes. Once the pancreas gets infected, of course, that cell that's supposed to produce insulin is also in the pancreas. So there's a good chance it's going to affect it. And once it gets affected, your chances of processing the insulin becomes a problem. So chronic pancreatic infection, sometimes cancer of the pancreas can lead to diabetes. Depending on which part of the pancreas it gets affected, it can lead to diabetes. Sometimes even surgeries. There are some surgeries where the pancreas has to be removed.
Yeah.
Yes, for one reason or the other, and then that can lead to diabetes as well. So that's one. And then other systemic conditions. Some thyroid conditions actually put you at a higher risk of developing diabetes. Your thyroid condition. Your thyroid also regulates a lot of your
establish that your mood and everything.
Perfect. So once there's a problem with it, it tends to affect some of the other organs as well and how they function. So some medical conditions can also lead to diabetes. And then even medications. Very, very important, because sometimes we as clinicians, we tend to sometimes not pay so much attention, but it's very important. It's a very, very common antihypertensive, by that I mean BP medications, can sometimes trigger your risk of getting diabetes. One of such is very, very common. Sometimes something we call beta blockers. Atenolol is very, very popular. It's a very popular medication. And actually it's been shown that, once you're on it, your blood sugar really has to be watched because it can tip you. Even some urine medications, yes, there are some medications that people are put on just to help them with their, to reduce urine and all that. Those can cause diabetes as well. And then some HIV medications, quite a number of them actually can increase your risk of developing diabetes as well. So there are other things apart from lifestyle and genetics, and I mean, though they might not form the bulk, honestly, lifestyle is like
a major
number one.
Yeah.
Obesity has been shown to be a very huge risk factor as far as diabetes is concerned. But these are other things that we can also look at when we talk about causes of diabetes.
It is interesting how you're mentioning medications predisposing you to diabetes, and so it's very
and one
important.
other that I almost forgot is something called corticosteroids that is used in asthmatics a lot.
Okay.
It's used in asthmatics a lot. That is also one very important medication. Dr. Kunidako talked about stress being a cause. And the reason why stress is a cause is that once you get stressed, there is a chemical, called the stress hormone. And that's very, very similar to the steroids that I'm talking about. That gets produced a lot. And once they produce, it actually affects the way insulin, functions. And so that medication is also very, very important when it comes to the risk of developing diabetes.
Yeah, I was making a point that it's interesting how you are saying medications can predispose you to diabetes, but then I don't think you are saying we shouldn't take those medications. You are just saying it should be under a medical professional supervision.
Perfect. Perfect. So it should really be prescribed by a medical person, a licensed medical person. And then by so doing, that is when you're going to know that, you're being checked, you're being reviewed. Once you go for regular review and then they check your blood sugar and all that, once it's kept in check, there isn't any problem.
Okay.
And that is not even to say that, by all means, these medications will cause diabetes.
It's a game of probability.
It increases your risk.
Okay.
Yes.
Okay. Before the show, I spoke to a couple of friends about diabetes to just test their knowledge on what they know.
Okay.
And I just want you to confirm, can excessive alcohol intake dispose you to diabetes? And also PCOS, how does PCOS predispose you to diabetes?
Interesting. So that's good. It's good to know that you brought this up. Excessive alcohol, as you know, when it comes to these chronic diseases, alcohol tends to always, what do you call it? A suspect.
Okay.
And that is because alcohol in itself is not very good for a lot of these organs, especially the liver. When it comes to glucose function, the liver plays a very, very, very important role as far as how glucose is even used in the body is concerned. And we all know that the liver is probably the most affected organ as far as alcohol intake is concerned. So once you take in alcohol and it affects the liver, definitely it can actually affect your sugar control and sometimes even the pancreas as well. So alcohol is also a risk as far as diabetes is concerned. Yeah. And then talking about PCOS. So what happens in PCOS is actually that sometimes when you have this condition, you tend to produce certain hormones.
Just before you continue, for the purposes of those who don't know PCOS is, just small what PCOS is and then how it can.
Okay, then I'll just be quick. Yeah. PCOS is something we call polycystic ovarian syndrome, where you have these usually fluid-filled balls or cavities within your ovaries. Okay. Yes, and that is what we call the PCOS. And that is something that is seen in quite a significant amount of women. For many people, it wouldn't even show symptoms. But for those that is going to show symptoms, risk of diabetes could be one of them. And that's just because when you have the PCOS, sometimes there are certain chemicals that are produced in your body, and it affects the function of glucose and how it's been for the want of a better, synthesized in your body, how it's being used in your body, and other things as well in your body, not just glucose. Your fat, how fat is even being used in your body can be affected when you have PCOS. So usually they won't come with just high blood sugar, they might also come with high cholesterol. So that is something that has been noticed in women with PCOS.
Right from the beginning, we established that diabetes is a very broad topic, and so we will have to bring the part two. But then, Dr. Dako, how do you test for diabetes? How do you go to the, is it blood work? Is it, how do you test for diabetes?
Okay, so, before I get to how you test for diabetes, you talked about steroids increasing your risk of diabetes. And I wanted to add a very important point for women and some men who use bleaching creams.
Okay.
Yes.
Bleaching creams are steroids.
Okay.
Topical steroids. And steroids in all forms can increase your risk of diabetes. So you'd have women who are using these bleaching creams and they end up in the clinic and they have diabetes.
Okay.
They have hypertension. They have a host of other things. So that's also something that we should look out for. All these, what do they call it? Toning, bleaching is the outright form.
Yeah.
But any cream you put on your skin and you notice your skin is getting lighter, is bleaching your skin. It must contain some kind of steroid, and you have to be very careful when using those things. It's not safe for you.
We'll come back to the testing.
Yes.
But then if you just joined us, this is the Living Well Show. We're talking about diabetes, and let me tell you, it has been an eye-opening discussion. There are things, I'm just finding out that bleaching can cause diabetes. So we'll go on a break. It can increase your risk of getting diabetes. So we'll go on a break. When we come back, we'll delve a little bit into that, and then we take the other segments. Don't go anywhere. Thank you for staying. We are still in studio with Dr. Darko and Dr. Nyama. Thank you, ladies and gentlemen, for having this discussion with me. Dr. Darko, 5 minutes, you were making a point. I'm sure we can't go into the diagnosis and treatment, so let's stay on the bleaching thing, and then the part 2, we can talk about the diagnosis and then the treatment. Okay. Yeah, you were making a point about bleaching, and we were talking about pills we ingest and all that.
A lot of our ladies are using creams and lotions that bleach their skin. And these days, like we were talking about during the break, that there are even pills that people take. And I hear there are even pills that people take when they are pregnant because they want their baby to have light skin. A lot of these things are very dangerous, very, very dangerous. And taking steroids and using steroid creams to bleach your skin is putting you at risk of diabetes. Yes, we want to be obakoko, but at what risk? At what are we willing to sacrifice for that? Are we willing to sacrifice our health? It's putting you at risk of diabetes. It's destroying your skin. It's giving you central obesity. Anybody who has used bleaching cream for a long time, you end up gaining weight around your belly, and you have this kind of thickness around the upper back and the shoulder, plus a host of other complications, including but not limited to diabetes. Okay, so you have somebody coming in, as soon as you see their skin and things, then you check their blood sugar, oh, it's high. One of the things that can bring that blood sugar down is if you stop all the skin creams. So it's very important that for ladies, you consider all this before you start popping pills and applying lotions to your skin to lighten it. Yes. Yes.
Right. Well, Dr. Nyama, I'll come to you soon, but then let's take the aerobic segment. We'll be back.
Relax. 3, 4, 5, 8, 9, get it, 3, 2, 4.
Thank you very much for your time at Metro Sports. Joining us today, share with us your experience and then the benefit that you have had today.
Okay, so I'm Gloria and from Ghana. So I was invited to come for this program and I would say it was a great experience. When I was coming, I was like, oh, wow. To come if something like this happens again. Yeah. Yep.
1, 2, 3, 4, 5, 6, 7, 8.
Walk us through your experience and everything that you have gotten today after the whole exercise and session.
Oh, well, the exercise is cool. You know, after a long month, long week, working, sitting in the office, you get to release stress and stretch your muscles. So it's great. It's a great activity. Well, I will encourage more people to join our aerobic exercise every ending of the month, getting to the end of the month. Yeah, it's good. Like you can get the opportunity to work out with.
Right, if you have been following the conversation, we have already established why it is important to exercise, because obesity is an underlying condition for diabetes. And so exercising cannot be overemphasized in this situation. But let's go to Chef Daryl and see what he has for us.
Welcome back to another episode of Living Well show on Metro TV. My name is Dale Freeman, your favourite executive chef here at Elisa Northridge in Accra. Today we're going to make a nice sardine and avocado salad, another healthy one for the people that are healthy, and the people that aren't healthy, we're going to train you and get you healthy. I hope you liked the mint booster last week. We've got some more smoothies coming on in a couple more episodes. But that was a little taster. So let's start with the salad. Okay, so what do we need for this sardine salad? One, we need sardines. Okay, so we've got some sardines here. Okay, so these are great for bone health, big in omega-3, and also for weight management as well. So a very good fish to have. Again, we're going to use some nice black olives. I explained what they were last time. We've got some lemon, which is also very good for weight loss. Got some red onion. Okay, as I mentioned before, red onion is a lot sweeter and not as harsh as white onion. Got the lovely chickpeas. We have avocado. Okay, now avocado has very good healthy fats and also makes you feel fuller for longer, which is another good benefit to have. We've got some nice garden peas. We got cucumber. Also we have some nice fresh tomatoes. I got some nice sesame seeds. Again, olive oil is a lot healthier than normal oil, so we're using olive oil. And then also I have a carrot, which we're going to be cutting up. So take a few more sesame seeds. A bit more oil. And there we have it. One sardine and avocado salad. Enjoy, give it a go. As I mentioned, chefs like to use small little plates and everything, so use a big plate, go wild, and have this as a meal. We'll see you next time on the Living Well Health Show here on Metro TV. And again, my name is Dale Freeman, your most loved executive chef here in Accra, and we'll see you soon.
Right, it has been an interesting conversation and an interesting episode. Today we were talking about diabetes, and we'll wrap up in the next 2 minutes. So let me go back to my guests, Dr. Darko, Dr. Muyama. 1 minute, your final words.
Diabetes is here with us. 1 in 2 people who have diabetes don't know they have diabetes. It's important that if you have somebody in your family with diabetes, or if you are above 40, you go and check your blood sugar to know if you have diabetes, because it's a silent killer.
All right. Thank you very much. Dr. Niyama, your final word.
Yes, so I think we haven't spoken much about it, but I'll just take this opportunity to introduce it. Next edition, we're going to talk a lot more about it. That has to do with the symptoms, the warning signs, and I want to just quickly hammer on them before we even leave here. I mean, if you realize that you are urinating a lot more frequently than you usually do,
and you're not pregnant,
and you're not, yes, you're not, thank you very much. And then you increase thirst, you realize that your mouth gets dry a lot easier, you feel very weak, very fatigued easily. And then you realize that when you develop sores, it takes a longer time for them to heal. I mean, these are signs of diabetes that you have to take note of. But in our next edition, we're going to touch more on that. But just to let you know.
So this is just an introduction to what to expect in the part 2 discussion of what diabetes is. I have been doing this discussion with Dr. Darko and Dr. Muyama. My name is Ethel Poplampo. Thank you for joining us. Enjoy the rest of our programs.